It is generally believed that health is the greatest wealth in the world. This therefore means that a healthy body and mind is essential to achieving a productive society. Governments in both developed and developing countries have continued to initiate health policies targeted at delivering better health services to the less endowed.
You will agree with me that health is wealth and it is very key. You only lead those that are alive. You cannot lead the dead.
While most advanced countries could be said to have already achieved some tangible outputs in health sectors, especially in the prevention of communicable diseases, reduction of maternal and infant mortality, as well as advancements in medical technology and wider participation of service users in health programming, developing countries, on the other hand, are still grappling with many challenges or barriers in getting access to and utilization of essential, appropriate and quality healthcare services.
Access to healthcare has always been a problem all over the world. That is why people are going for universal health coverage where everybody will have access.
The desire to achieve a more impressive outcome in healthcare tends to have spurred many actors in the healthcare chain to embrace essential health packages delivered through primary health care. Nevertheless, providing effective and quality health services in the local community has never been an easy task for any government.
When you look at the health indices, it's not good for Nigeria. Delta State may be likely better when you're looking at Nigerian nation as a whole, but even then it's not good enough.
This task of delivering sound health care to the rural and urban poor has been at the center of health policies initiated by the administration of Governor Ifeanyi Okowa in Delta State in the last 4 years. A major thrust in the health policy is the strengthening of the primary healthcare delivery system.
His Excellency envisioned a Delta where everybody who lives, works, plays in Delta State actually has access to quality, effective and affordable health care.
At the community level, we'll mobilize the community, we make them participate in our program that will benefit the community and let them own those programs.
The desire to expand the healthcare coverage propelled Governor Ifeanyi Okowa to reposition the state's primary healthcare development agency. Through a well-articulated health program of the agency, the administration has been able to drive quality healthcare down to the grassroots. The first strategic decision of the governor in this regard was to address the poor governance structure of the Primary Healthcare Development Agency. This strategic thinking gave birth to a policy tagged Primary Healthcare Under One Roof. The administration further approved the full implementation of the state's Primary Healthcare Development Agency law enacted in 2006. The law places a high premium on training and orientation of staff for optimum and qualitative services.
We are one of the few states who have brought the entire primary healthcare under one roof. We have in excess of 450 primary healthcare centers. Right now, 107 of them have been largely activated and then annexed into the universal primary healthcare scheme that we're running across the network. Before 2023, part of the deliverables of the state government is to ensure that every ward and the local government must have a functional primary health care.
Undoubtedly, through the impact of the Primary Healthcare Development Agency in the state, more than 80% of common health needs are being tackled through effective detection, prevention and management of illnesses. Much more important is the localization of the health services of the agency. Such grassroots intervention has made it easy for people with health issues to access essential health services in various communities.
Primary health care is such a necessity because that's the very first step where people come to. And then that's where you impact what needs to be done. That's where you check them out. That's where you do everything before they move up. So that basic primary care is where preventive, diagnosis, education, everything, awareness starts. And once that is in place, then everything else moves up from there.
Health centers have been there in existence for several years, but they are being strengthened to be able to provide qualitative care. We've had primary health centers in each of the LGAs. That is bringing it closer to the people. So that is one of the ways of providing universal health coverage for Deltans in Delta State.
Chairman of the Primary Healthcare Development Agency, Dr. Isioma Okoba, and members of our team regularly embark on facility tour of health centers across the state to ensure that standards and quality healthcare services are adhered to. During such visitations, issues of public and family health, nutrition, personal hygiene, reproductive health, among others, are usually subject of discourse to help promote preventive care.
The purpose of this exercise is taking healthcare to all the nooks and crannies of Delta State. We're making sure that no Deltan is left behind in accessing quality and affordable healthcare.
The Primary Healthcare Agency has put up measures to check the scourge of malaria. The Delta State government, in collaboration with partners in the Malaria Elimination Program, has reduced the number of cases by 50%, especially in pregnant women and children. Dr. Onojeta, the agency's Director of Community Development, Social Mobilization and Advocacy, said that government routinely distributed insecticide-treated nets to pregnant women and children under 5 years of age.
All commodities related to malaria in the state are available. We also have injection artesunate meant for severe malaria that are referred to secondary and tertiary health facility, and they are also free. So management of malaria in the state is free of charge. So his program on health are very smart as he is.
In line with the smart agenda of this administration, Governor Ifeanyi Okowa had provided the enabling environment and financial support for routine immunization at all primary healthcare centers in the state.
Smart Delta.
Family health and birth control aren't left out in the scheme, as sensitization and activities geared towards controlling population and ensuring the overall welfare of women and adolescents. Dr. Philomena Okewawo gives insights on the policies and support of the state government for this cause.
Family planning is one of the pillars of SONL, the Save 1 Million Lives program. His Excellency, but the Honorable Commissioner, has been given approvals for enhancement of family planning services in the state.
We talk to them, we educate them, we tell them the importance of things like breastfeeding. It's very important for them to breastfeed their baby, to adopt this exclusive breastfeeding. We tell them the advantages, that it creates that bond between a child and a mother. It is very cheap, it is easily accessible.
They used to educate us on how to become a mother, their responsibilities and what to do as a mother. Even the new ones that are pregnant, they educate them on what to do and what not to do as a pregnant mother.
The Delta State Primary Healthcare Development Agency is progressing with the rest of the world as they have taken a step further to make access to healthcare digital. Rosalind Amobi, in an interview with Smart Delta, explains how beneficial e-health is to the state.
The e-health aspect is introducing ICT into health, making it a little bit easier, accessible and fast. You can even be in your room and access treatment from the primary healthcare center if you have the doctor's number through e-health.
To ensure a holistic approach to key areas, the Delta State Primary Healthcare Development Agency formed a stronger partnership with other agencies involved in public health, hence the Ministry of Environment, Ministry of Water Resources, and bodies like the WHO, UNICEF, Rotary Club, Catholic Relief Services, Carter Center, and many more are partners to the agency. There is also a solid partnership between the state government through the Delta State's Contributory Health Commission, the Bank of Industry, financial institutions, and the Farm Access Foundation.
To be able to fund it, you need to have collaborate with the private sector to run it, because government can run most of those facilities. And then we'll begin to have some relationship with Bank of Industry to get some soft loans with pharmacists that are collaborating to see how some private sector will be given some level of loans. We're doing that to enable individuals, private sector people, man most of those centers in those areas and provide those facilities.
The whole point is to be able to enroll as many indigents as possible and provide them with the basic necessities, the basic health care, ultimately to improve the health outcomes of the community.
Besides, the administration's efforts at taking healthcare to the people in their localities, Governor Fanyakoa took another bold step towards expanding accessibility by establishing the Contributory Health Insurance Commission. The scheme is modeled after the National Health Insurance Scheme, and in less than 2.5 years, it has become a reference point in Nigeria and beyond.
One major thing about health insurance is that whether people have money at hand or not, there's this confidence they have, stepping into the hospital because they know someone will pick the bills, if not everything, at least to a large extent.
It has alleviated a lot of sufferings for the common people in the service. A lot of them are really appreciating this program. We thank God for the governor that God has given to us, and we pray that God will give him more grace to do more for us.
The scheme is changing the narratives of age-long financial hardship experienced by the populace, as enrollees on the scheme no longer have to make out-of-pocket payment. As at the last count, the Commission has over 500,000 plus enrollees benefiting from the scheme.
COA is making healthcare cheaper because everybody's putting money together because nobody plans for health challenges. And so when it comes, there's some money available to take the hits off you. That's indeed the way to go.
I'm benefiting from it. When the doctor check us, they normally give us our drugs that we needed.
The drive to overhaul the system and sustain the progress led the administration to the renovation, re-equipping and upgrade of selected 110 primary health centers across the 25 local government areas. These health centers were accredited by the Delta State Contributory Health Commission to ensure that enrollees enjoy easy access to proper and adequate health care close to them.
For the first time when I came here to register, I didn't pay for anything. Both the drug that they give to us is free. Thank you, Governor Okowa, as you create this great program for us. We are grateful. God will bless you.
Starting from the very first day I started Mantinental here, everything was made free, the tests, the run, and the rest of them. And I thank the government of Okowa for making it possible for we, the pregnant women, to have access.
The second phase will ensure that no fewer than 268 functional healthcare centers exist in all the wards, and subsequently, all the 440 centers across the state will benefit from the new lease of life. The massive upgrade of community-based healthcare facilities is a framework that supports outsourcing of defunct and abandoned healthcare facilities to the private sector to revitalize and provide services to the enrollees of the health insurance scheme, especially in the rural areas.
We live in a country where the pseudo-infrastructure, which is not complete, exists, but people are lacking care. The government may not have the funding to do all the capital expenditure that it requires, especially regarding healthcare. So why don't we bring the efficiency of the private sector into the public sector to see how we can get results for Nigerian people?
We have a situation where there are quite a lot of healthcare facilities in Delta State. Quite a lot of them have not been performing optimally due to financial difficulties. Pharmacess has come in with an access to finance program supported by Bank of Industry and other agencies, and then the Contributory Health Commission, which is a health finance management organization, create a system in which we're able to harness healthcare resources to provide quality healthcare to the residents of Delta State, and also create affordability for them to be able to access those healthcare without becoming impoverished as a result of that.
Hey, welcome to Delta. Governor, where they want to go.
Hi, my name is Fretless, and I live in Asaba, capital city of Delta State. As an entertainer, my job entails a lot of movement from one place to the other, and also to be at the right place at the right time, meaning that I need good roads to be able to meet up with work or appointments. And with the new government reform on construction and rehabilitation of all major and feeder roads in the state as part of a smart agenda, it has become so easy for me to move around at all times. Now, I just cruise from street to street, city to city, all over the state. And even apart from the roads as I move along daily, I see magnificent projects everywhere. Check out this one in Warri and several other places. Wow. Governor Koa is indeed a man with a vision.
Come see empowerment through the step and the again. Your education and sports development. That's what they with Okowa.
Egbema community, home to about 40,000 Deltans for several decades, has not enjoyed basic health care and other amenities as a result of their terrain located in the riverine community. Today, their story is different. The journeys to hard-to-reach riverine communities are no mere jokes. On a 3-hour boat ride from Warri to Egbema community in Warri North local government area, the Smart Delta team, in company of the Delta State Contributory Health Commission DSCHC team, arrived Polobobo and Shekelewu and were greeted with a carnival-like event. The community rolled out its drums to celebrate a new lease of life, with thousands gathered at the Cottage Hospital for an auspicious event. The governor, who was represented by his chief of staff, harped on the benefits of partnership, a transaction that has seen to several developments.
The quality of the team that is here today is not just personnel from the state. They also form the partnership with doctors and nurses from outside Nigeria. That shows there's a commitment. And when you have such partnerships, it helps to establish the kind of quality of service you're going to have in the facility.
Before the establishment of this cottage hospital, our women do travel down to Saple, to Koko before giving birth. And that costs us a lot. So now that this hospital has been established in this community, it will be of benefit to the women of this community and to the youth and to the elders of this community.
Monarch of the Egbema Kingdom, Bini Pere III, and his subjects expressed gratitude for the huge gesture by the government and expressed optimism that the Ifeanyi Okowa-led government is a promise keeper.
This, to me, is one of the most important things that I have been yearning for, and the lieutenant governor in person of Okowa has done it. I said, look, let me personally come and attend.
This project is a gift from God. Something they've been hoping for so many years have come to pass. It is a Lord's doing.
The dream we had for 20 years above is now come true. We are happy people to live to see today.
The next day, the team embarked on another 30-minute boat ride to Gbaramatu Kingdom, a beautiful, peaceful and heartwarming community where DSCHC also took over the running of a cottage hospital built and abandoned previously.
I've come with my friends from Atlanta, Georgia. One of them is a doctor, one of them is a nurse, one of them is a pharmacist. I told them what I was doing and they said they would follow me to Prosa Kingdom. This is their first time on water. They said they want to follow me here, not just today. They will be here to provide their technical support to ensure that quality healthcare is available for all residents of Gbaramatu Kingdom.
His Royal Majesty Oboro Gbaran II Aketekpe Agadagba and other members of the community expressed delight that the health challenges experienced in the community will soon be a thing of the past.
We commissioned this hospital with God the Father.
Governor Okowa is actually a visionary leader, he's a purpose-driven leader, he's the people-oriented leader, and he's very close to the people, and he knows the pains of the people.
Before you carry person from here to Warri, at times anything can happen for the road. So the clinic when government bring for us, we appreciate and we like them.
I'm impressed for what the government is doing, providing healthcare to this community.
With the commissioning of both primary healthcare facilities in the hard-to-reach riverine areas of Delta State, Egbema and Gbaramatu communities, there seems to be a rising hope of better life for its residents. The Director General of the Commission, Dr. Ben Nkechika, and his team already have commenced registration of the enrollees in the kingdom, noting that the team from the United States will be on hand to lend support with health care as is obtainable in the developed world.
Our terms of reference is to provide primary health care and secondary health care services in this place, meaning that we can do as minor healthcare delivery as possible and go as high as providing surgeries, and as God will have it, we have the skill to be able to challenge such healthcare challenges.
What we're going to do
is to make sure there's compliance, both in the medical provider section and also in the patient section. Make sure they're taking their medication the way that the doctor had instructed them to take, and to continue to educate them.
If someone had told me that a health facility in a riverine area will be this well equipped, I would have said the person is lying. All the minor surgeries and even major surgeries are proved to be done yet.
Another laudable event took place at TERTIARY in Warri South local government area, also known as Big Warri, the traditional home of the Olu of Warri. The event recorded the official handing over of a standard primary health care center still under construction by DESOPADEC to the State Contributory Commission to be put into use for the benefit of the people.
On behalf of DESOPADEC, this is to say that the construction of the primary health care center located at TERTIARY, Warri South local government, is being handed over to Delta State Contributory Health Commission for the use and the benefit of our brothers and sisters that are living in TERTIARY.
Health is wealth. This is one area that we have always been lacking. So your intervention will go a long way in assisting all the communities in this locality.
If the health center is completed, it's going to be very good for us here because we will no longer be going to Warri for treatment.
It was a dream come true for the people. They enumerated the many benefits that this gesture will bring their way, as the Director General expressed confidence and capability in the management and daily running of the facility.
Our mandate is to ensure that the TERTIARY Healthcare Facility commences service within the next 2 months, and the DESOPADEC has also offered to provide a boat ambulance that will go to all the riverine rural communities nearby, bring patients here, or will take service to them, so that we ensure that people of the TERTIARY Kingdom have access to quality healthcare.
As the prosperity train berthed at Akumazu Mocha in Ikano East local government area, the team took an on-the-spot assessment of the abandoned health facility to ascertain the level of repairs and upgrade needed to keep the facility up and running. It was a pleasant surprise as indigents bear witness that it was first of its kind in the history of the community.
For long we have been expecting this type of thing, and we are happy this time it have happened. May God bless the government that made this impossible.
The gesture that we have gotten today goes a lot to speak of the government. I've been hearing of help for all debtors. I have now experienced it. It's a very deep loss to our governor.
The governor has done well by providing these health facilities for us. What this means is that we would no longer go to Abo and distant places for treatment. I urge him to keep it up.
The visit was an eye-opener, and with the future prospect envisaged, Mr. Charles Aniago, an indigene of Akumazi Kingdom, promised to pay the premium fee of 7,000 naira each for the first 200 enrollees in the center as soon as it commences operation. This no doubt gave a boost to their expectations.
Smart Delta.
The Governor Fanyo Kowa-led administration has also made huge investments in the secondary and tertiary healthcare delivery system. This investment in manpower and facility have been matched with a conscious effort at improving the synergy between healthcare providers at the primary level and their counterparts at the secondary and tertiary healthcare levels.
For the primary health, we've just done over 110 PSC renovations. We're also involved in training personnel to improve capacity and help our medical personnel be able to offer appropriate modern medical service to teeming Deltans.
His Excellency knows that you can't just have a building and not have the human resources to run it. And so he went ahead and mandated that we employ medical doctors, nurses and midwives, health assistants, and community health extension workers to man these primary healthcare centers across Delta states.
The smart initiatives of Governor Kowa in the primary healthcare subsector have continued to enjoy the strong support of the Office of the State's First Lady, Dame Edith Okowa. Through her pet project 05 initiative, Mrs. Okowa and her partners have continued to bring smiles to the faces of rural and urban poor.
Hey, see the leg.
This miracle will do for us. Where God send am to come heal us. God will give am long life with the old man.
Delta should expect more of what we've done before. More persons will receive their sight, more glasses, more homes for the homeless, more food for those that cannot feed, more of everything good.
Governor Ifeanyi Okowa envisions a Delta where everybody who lives and works in the state would have easy access to quality, effective and affordable healthcare services irrespective of social status or geographical location. Delta State is on the track towards better days.
Run, come to Delta State. Come and see the good things where Okowa they do. You better run, come to Delta State. Come and see the good things where Okowa they do. I see your job and work creation in Delta make the youth say them highlight. Okowa. I see good roads everywhere in Delta make the people say them cola. Come live in Delta. Say me I say. Come invest in Delta. Come explore the potentials of our state.